Well, friends, welcome to today's webinar. And Dr. Jyoti is ready with her group, Biochemistry Group 3, that is the chemistry and metabolism of lipids. Over to you, Dr. Jyoti and team.
Thank you so much, Bedi sir, for giving this platform. Actually, when I joined this platform, I never thought I'll learn so much while mentoring the presentations. I request and of course, I would like to thank Dr. Sucheta ma'am for my stupid inquiries on and off, and she has supported me a long way. Thank you, ma'am. So now I will request Dr. Hardik to carry on and take the baton forward.
Okay.
Hello.
Thank you, madam. Thank you, madam.
Yeah, please.
Myself.
Yeah.
Yes. Good evening to all senior faculty members and my colleagues. Today.
All the best, everyone.
Thank you, madam.
Yes,
Today
go
we
ahead.
CBME. Yes, ma'am. Today we CBME Biochemistry Group 3 will discuss about the competency number BI4, which relate with the chemistry and metabolism of lipid. So without wasting much time, we start with the in each and every competency, we are discussing the specific learning objectives associated with teaching learning methods, their integration if it is there, assessment methods, and estimated teaching hours. So the competency number 4.1, which is prepared by and presented by myself, Dr. Hardik Javia. Competency number BI 4.1, it is the describe and discuss main classes of lipids, which include essential, non-essential fatty acids, cholesterol and hormonal steroids, triglyceride, major phospholipids, and sphingolipids, which relevant to a human system and their major function. Estimated time duration to compile this competency is minimum 2 hours. Regarding the specific learning objective, at the end of the session, phase 1 students should be able to define and classify lipids, explain simple, compound, and derived lipids with their examples, define the essential fatty acids, enlist them with their biological functions and deficiency manifestations, explain the role of polyunsaturated fatty acid, which are the essential fatty acids, describe composition of triglyceride with its important chemical properties in relation to its biological functions, specifically the acidity and all this. Explain the composition and biological significance of various phospholipids. Then differentiate between the plasmalogen, which is the ether lipids, and they differentiate from the classical phospholipids. Explain the biochemical effect, clinical features, and diagnosis of respiratory distress syndrome. Describe structure and function of cholesterol. Describe the functions of hormonal steroids, which include vitamin D, estrogen, progesterone, testosterone, glucocorticoids, and mineralocorticoids. Specifically, regarding these competency BI 4.1, we can integrate the SLO8, which relate to respiratory distress syndrome. We can integrate with the pediatric department, and SLO10, which are the function of hormonal steroids, which can be shared with the physiology department. The teaching learning method we can use are the lecture, small group, self-directed learning, tutorial, and case-based learning. Also specifically case-based learning for respiratory distress syndrome. Assessment method we can use are the MCQs, short answer questions, and Viva voice. Now for the competency BI 4.2, I hand over the mic to Dr. Debasis Basu sir. Please sir.
Hello, Basu sir, are you there? Okay. Dr. Hardik?
Sure, ma'am, I will continue. So the competency 4.2, it is prepared by Dr. Jaya madam, Dr. Harpit ma'am, and myself, and presented by Basu sir and Jayan sir. Unfortunately, Basu sir is not available, so I will continue in behalf of them. BI 4.2 is the describe the process involved in digestion and absorption of dietary lipids, and also the key features of their metabolism. The estimated time duration for these metabolism competency is the 8 hours. Regarding this SLOs, the first topic under the BI 4.2 is the digestion and absorption of lipid. At the end of the session, phase 1 students should be able to list the various dietary lipids, mention the sites and describe the role of various lipases and other enzymes, hormones and bile salts in lipid digestion. Explain the process and advantages of emulsification of fat and formation of micelles. Mention the end product of digestion of lipids and their absorption. Next one is the explain how lipids are reassembled in the mucosal cells and transported into a lymphatics and blood vessels. And the define steatoria, mention its causes, and explain the biochemical finding that help in the differential diagnosis of steatoria. The teaching learning method we can use for these is the lecture and small group discussion also. Assessment methods are structured LAQ, case-based vignettes, SAQs, and Viva voice. Time duration, estimated time duration for this topic of the competency is the 1 hour. Second topic is fatty acid oxidation. For that, at the end of the session, phase 1 students should be able to explain how the body mobilizes depot fat from the adipose tissue for energy, role of hormone sensitive lipase, and the factors regulating it. Mention the various types of fatty acid oxidation along with the organelles involved. Describe the role of carnitine in fatty acid oxidation. Explain why small and medium chain fatty acids can be oxidized in the carnitine deficiency. Describe in detail how long chain fatty acids like palmitic acid are oxidized for energy by the body along with the factors which regulating the same. Explain the high energy yield from oxidation of one palmitic acid and differentiate between the different types of oxidation of fatty acids. Mention the products of oat chain fatty acid oxidation and explain their fat. And last is the discuss the biochemical findings and clinical features of disease conditions due to impaired fatty acid oxidation. The teaching learning method we can use are the lectures, small group discussion, and case-based learning, specifically at disease conditions. Assessment methods are structured long answer questions, case-based vignettes, SAQs, Viva voice, and also case charts. An estimated time duration for this topic is the 2 hours. The third one is the fatty acid synthesis. At the end of the session, phase 1 students will be able to outline the synthesis of palmitic acid in the body, mention the advantages of the fatty acid synthase complex in the body, mention the other multi-enzyme complex related with them, describe the desaturase and the chain elongation system involved in the fatty acid synthesis, and explain why the essential fatty acids cannot be synthesized by our body. Fourth one is differentiate between beta oxidation and synthesis of fatty acids. This one is discuss reciprocal regulation of fatty acid synthesis and oxidation both. Teaching learning method similar like previous one, lecture, seminar, and small group discussion. Assessment method we can use are the modified structure LAQs, SAQs, and Viva voice. The time duration required for this topic is the 2 hours. Next is the topic is the ketone body metabolism. At the end of the session, the phase 1 students should be able to name the different ketone bodies and their importance, mention the sites and synthesis of ketone bodies, which is known as the ketogenesis, mention the organ that utilize ketone body and explain the steps involved in their utilization, which is known as the ketolysis. Define the term ketonemia, ketonuria, and ketosis. Explain the regulation of ketone body metabolism. Explain the biochemical basis for the signs and symptoms of ketoacidosis. Mention the causes for ketosis and discuss the laboratory methods to detect the ketone bodies in urine. Specifically for this topic of the competency, we can integrate it with the general medicine, specifically with the biochemical basis of signs and symptoms of ketoacidosis. Teaching learning method we can use are the lecture, small group discussion, case-based learning. And the assessment method we can use are the MCQ, SAQ, long answer question, test reports, and Viva voice. The estimated time which is required is 1 hour. The next one is the cholesterol
Thank you,
metabolism.
Dr. Hardik. Dr. Jain is there.
Okay, sure, ma'am. I hand over.
Dr. Jain Day is there. He is going to present next of it. Yeah, please.
Sure.
Jain sir. Jain sir.
Jyoti, I don't see Dr. Jain. Just a moment.
Okay. I will get it done. I will get it done. Not an issue. Dr. Hardik has done a lot of this thing. He must be tired. I will read these SLOs. Not an issue. Specific learning objectives, SLOs for topic cholesterol metabolism. At the end of the session, phase 1 students should be able to mention the biological importance of cholesterol in the body, mention the organ and subcellular location of cholesterol biosynthesis, describe the biosynthesis of cholesterol from acetyl-CoA to guanylate, discuss the role of HMG-CoA reductase in regulation of cholesterol synthesis, mention the short-term and long-term regulation of cholesterol biosynthesis in the body. Dr. Hardik, can you change the slide, please? Then describe the mechanism of action of various drugs used to lower blood cholesterol levels, summarize the metabolic fate of cholesterol in the body, explain the formation of bile acids, primary and secondary, and as the breakdown product of cholesterol metabolism and its enterohepatic circulation. Integration with general medicine, teaching learning method, lectures, seminars, small group discussion, CBL, assessment methods, MCQs, SAQs, long answer questions, case reports, and Viva voce. Estimated time duration is 1 hour. And next is Dr. Jain. Still could not join?
I don't.
Sir, you can unmute Dr. Priya. She will read.
Okay.
Yeah, Dr. Priya can continue.
Priya can unmute herself. She's self-muted.
No, ma'am, I'll continue. So specific learning objectives with the topic complex lipid metabolism. So at the end of the session, phase 1 students should be able to explain how different phospholipids can be synthesized from triglycerides, discuss the role of various phospholipase in degradation of lecithin, mention the lipid storage disorders and biochemical defect associated with them. So the methods are seminar, tutorials, CBL and SDL. Assessment methods are MCQs, SAQs and Viva voce. Estimated time duration is 1 hour. Triglyceride metabolism. So end of the session, phase 1 students should be able to mention the site and list the substrates required for the synthesis of triglycerides, describe the synthesis of triglycerides, describe the degradation of triglycerides. So the methods are lectures, seminars, and tutorials. Assessment methods are MCQs, SAQs, and Viva voce. Estimated time duration is 30 minutes. Topic is fatty liver and lipotropic factors. At the end of the session, phase 1 students should be able to define fatty liver and discuss the various causes of fatty liver, outline the progression and consequence of fatty liver, differentiate between alcoholic and non-alcoholic steatohepatitis, describe the role of various lipotropic factors in fatty liver. So the teaching learning method is lecture, seminars, tutorials, and CBL. Assessment method are MCQs, SAQs, and Viva voce. Estimated time duration is 30 minutes.
Ma'am, am I audible?
Yeah, you are, Dr. Jisha.
Okay. Good evening, everyone. Thank you, Dr. Priya. I'll be presenting Competency BI 4.3 and 4.4. These SLOs were prepared by Dr. Priya, Dr. Indira, and myself with significant contribution from the rest of the team. Next slide, please. These competencies have been put together to avoid any overlaps. Competency 4.4 is describe the structure and functions of lipoproteins, their functions, interrelations, and relations with atherosclerosis. Competency BI 4.3 is explain the regulation of lipoprotein metabolism and associated disorders. The estimated time duration is 2 hours. Coming to specific learning objectives, at the end of the session, phase 1 students should be able to describe the structure, composition, and functions of various lipoproteins, classify the lipoproteins and state the major lipid and protein component in each with their relative proportion by molecular weight, describe the formation, cellular uptake, and fate of chylomicrons, describe the formation, cellular uptake, and fate of VLDL and LDL with emphasis on receptor-mediated endocytosis. Describe the formation, cellular uptake, and fate of HDL. Explain the role of various apolipoproteins in the metabolism of lipoproteins. Explain the function and significance of CETP, LCAT, and ACAT in the metabolism of lipoproteins. Explain the role of lipoprotein lipase. Classify hypo and hyperlipoproteinemia based on Fredrickson's criteria. Mention the biochemical defects associated with the lab findings. Define atherosclerosis. Explain the role of lipids in atherogenesis with emphasis to oxidized LDL, lipoprotein A, small dense LDL, HDL. Mention the important markers of atherosclerosis. SLOs 9, 10, and 11 can be integrated with general medicine. Teaching learning methods may include lectures, case-based learning, small group discussion, and early clinical exposure. Assessment methods may include multiple choice questions, short answer questions, case reports, and viva voce. Thank you, everyone.
Yeah, Dr. Hariharan, please.
Good evening, respected. Yes, ma'am. Thank you, ma'am. Good evening, respected seniors and colleagues. This is Dr. Hariharan, and I will be presenting competency 4.5 and 4.7. The competency was prepared by myself, Dr. Jain, Dr. Chandan, and Dr. Harpreet. Next slide. The competency is about interpret laboratory result of next slide, sir. The competency is about interpret laboratory result of analytes associated with metabolism of lipid. At the end of the session, the student should be able to explain the biochemical reference interval of the total cholesterol, HDL, LDL, VLDL, and triglyceride as per the current National Cholesterol Education Program guideline. Discuss the importance of total cholesterol HDL ratio, LDL HDL ratio, enumerate different lipid and non-lipid biochemical markers of ischemic heart disease. Next slide.
Dr. Hariharan.
Next slide. Yes, interpret the lipid profile
Dr.
of
Hariharan.
lipoprotein
Yeah,
analysis and mention the type of lipoprotein. Yes, ma'am. Hello. Hello. Ma'am. Am I audible? Hello. Hello.
Yes, you're audible.
Hello. Mention other special
Yes,
specific
you are.
biochemical analytes associated with defects of lipid metabolism.
You are audible, Dr. Hariharan.
Chain acyl CoA dehydrogenase deficiency. Propenyl CoA carboxylase deficiency, organic aciduria. Enumerate the biochemical pictures of plasma or serum in metabolic syndrome. So the integration is with general medicine. Teaching learning method is lecture, small group discussion, case-based training. Assessment method is structured long answer question, short answer question, MCQ, and Viva OC. And the estimated time duration is 2 hours during practical time. Next competency is 4.6, be presented by Dr. Chandan sir. Chandan sir.
A very good evening to all my faculty members, my dear colleagues and friends. Today I am going to present the competency BI 4.6. The competency has been prepared by Dr. Durga Prasad sir and myself, Dr. Hema Chandan Kumar, Assistant Professor Biochemistry from Hyderabad. Competency number BI 4.6 describe the therapeutic uses of prostaglandins and inhibitors of eicosanoid synthesis. The estimation time duration for this competency will be 1 hour. SLOs for this topic: at the end of the session, phase 1 student should be able to define eicosanoids and discuss the source of prostaglandins, prostacyclins, thromboxanes, and leukotrienes. Describe the mechanism of action of prostaglandins and thromboxanes. Compare and contrast the biological actions of various prostaglandins. Discuss the therapeutic applications of prostaglandins. Describe the inhibitors of cyclooxygenase enzymes and their clinical applications. Mention the biological importance of thromboxanes and leukotrienes. The integration for this SLO can be done with pharmacology, SLO 5. Teaching learning methods will be lectures, seminars, SDLs, and case-based learning. Assessment methods can be done using MCQs, SAQs, case reports, and Viva OC. Thank you, ma'am.
Well done. So we are coming to the second section of the presentation. Dr. Jaya.
Yes, a very good evening to you all. Am I audible?
Yes, ma'am.
Yes, a very good evening to you all. At the outset, I'd like to thank the organizers for this wonderful platform, not only to learn, but also to unlearn some of the orthodox approaches to biochemistry. Special thanks to Dr. Sanjay Bedi and all the wonderful mentors. A big thanks to our mentor, Dr. Jyoti Batra, who's been encouraging, coordinating, and totally guiding us through this entire process. So I'm here to now present one of the teaching learning methods, which is self-directed learning. I'm Dr. Jaya from St. John's Medical College. Next slide, please. So the topic chosen for the self-directed learning here is diabetic ketoacidosis. Next slide. So this topic was chosen with the knowledge that the students have already been exposed to metabolism of carbohydrates, water entered metabolism, and acid-base balance. So as with any other SDL, students were given instructions and pre-reading materials a priori. So the students were instructed to refer to classroom discussions that had already happened on ketone body metabolism and its regulation, which were uploaded in the institution's learning management system. Students were then given pre-reading materials on ketoacidosis, which includes textbook references, video links on ketoacidosis. Since this topic is a must-know portion, the students were informed that there would be a discussion and a formative assessment following the discussion on this topic. Next slide. So during the session, the classroom, it was conducted during the practical hours to facilitate small group discussions. The students were divided into multiple teams. A case scenario on diabetic ketoacidosis was provided to each team. The case has been mentioned on the right-hand side. It's a case of type 1 diabetic with characteristic signs and symptoms of ketoacidosis, along with the relevant biochemical investigations and the biological reference interval for the same. A faculty was assigned to each team to facilitate the discussion to ensure the achievement of the desired learning objectives. Now, the learning objectives were also listed and provided to the facilitator in advance, which included some of them were that the students should be able to name the ketone bodies, explain the terms ketonemia, ketonuria, and ketosis, mention the common causes for ketoacidosis, should be able to explain the derangement in lipid metabolism leading to ketoacidosis in diabetes, identify the signs and symptoms associated with DKA, and explain the diagnostic criteria and lab findings associated with DKA as well. Next slide. So after the teams or each team was allowed to interact with the members as well as discuss the interpretive findings with the faculty, a formative assessment was then conducted. So some of the questions are as follows. They were designed to ensure that the objectives would be tested. So it started off with basic questions like name the ketone bodies. 2 pictures of signs and symptoms were given to the students to identify those which would be associated with DKA. Next. A match the following question was designed to on one column with some of the terms and signs and symptoms, and on the second column the definitions of those terms as well as the biochemical parameters associated with the signs and symptoms, so that the students would be tested on if they can correlate the biochemical findings with the signs and symptoms. Next slide. So this assessment, the formative assessment, would then be evaluated and discussed, and the formal feedback would be given to the students. Now, to allow the students to ponder further on this topic and also to correlate the role of diagnostic biochem laboratory in the approach to DKA, an additional follow-up topic for STL was then announced, which is a simple topic like, for example, the role of POCT devices in the laboratory evaluation of DKA. The 2 simple objectives that we wanted the students to be able to learn was to identify and mention glucometers, urine strips, and ABG analyzer as a POCT device, which can be used either in a resource poor setting, in an emergency setting, or in the hospital ward, and explain the usefulness of these devices in the evaluation of patients with DKA, and explain the principle of estimation of these analyzed estimated in DKA by these devices. The students were not given any pre-reading material because these were part of practical competencies that the students were required to achieve, and so they were asked to refer to their practical portions and submit an assignment covering these 2 SLOs, which of course will also be then evaluated, discussed, and a feedback given. So with that, I complete my presentation on this simple topic of self-directed learning module. Thank you all very much.
Good evening to all my senior professors and colleagues. At the outset, my heartfelt gratitude to Sanjay Bedi sir, Suchita ma'am, Prajna ma'am for providing us a platform to understand the concept of CBME much better. I would also take this privilege to thank profusely our mentor Jyoti ma'am, who has taken keen interest in guiding the group to get the best out of each one of us. So with this note, over to the topic, the early clinical exposure. So the concept of early clinical exposure was prompted to overcome the shortcomings which was created during the preclinical disciplines and the clinical settings. So I would like to present a topic that is lipoproteins and relations with atherosclerosis. I myself, Dr. Hilda Priya D'Souza. So the ECE module is, the setting is the hospital and the central lab. In case this is not available, we can also always go into something called as virtual patient app, that is insimo.com. This is where the students can go online through their mobile and they can make diagnosis. Also, they can add up the investigations and the treatment. So the inbuilt feedback about where they have gone wrong or if anything is not okay. So that gives them input, that is the answers for their questions. So maybe this virtual patient is good for a country like ours, where not everybody can practice. So the use of technology can create actual experience. So the topic of basic science, that is lipoprotein and its relation with atherosclerosis, which is covered in the lipids competency number 4.3 and 4.4. ECE is through stable angina case, where we have done a role play and shown the students the biochemical reports. So the overall goal is the student must be able to recognize the relevance of the lipid profile in diagnosis, patient care, and treatment of dyslipidemia. So the specific learning objectives, the SLOs, at the end of the session, the students should be able to identify the clinical features of different types of hyperlipoproteinemia based on Fredrickson's classification. Mention the metabolic defects which is associated with each of the hyperlipoproteinemia. Reason out the biochemical basis for the derangement of different lipoprotein findings. Explain the role of various lipoproteins in atherogenesis. Identify the modificable and non-modificable risk factors. Mention the important markers of atherosclerosis. Explain the basis of necessary dietary and lifestyle modifications to prevent atherosclerosis. Explain the basis of the treatment of hyperlipoproteinemia. So the expectant competency would be the students should demonstrate the understanding of alterations in the lipid profile in dyslipidemia. They should be able to correlate the clinical manifestation in different hyperlipoproteinemia with altered lipid profile. They should be able to explain the basis and rationale of the lipid profile test that is done in dyslipidemia. The student should be able to understand the role of hyperlipidemia in atherosclerotic disease and use it as a tool for the assessment of cardiovascular risk. So the learning experience, which lasts for total hours, was 3 hours. So the first 30 minutes, the introduction was given about the module, the division was done, and instruction by the faculty. And the next 90 minutes were the clinical experience, where the exposure to the clinical context, in case available wards and lab. The last 10 minutes were the summary and the biochemical correlation and conclusion. The post-assessment was done with 20 minutes. And the last 30 minutes were reflection. In the sense, what happened? What did they learn from this experience? So what are the applications of this learning? What next? What knowledge or skills do they need to develop so that they can handle this type of situation? So let me just briefly go through the case presentation. This is the case where the 23 years old male college student felt heaviness in his chest after walking a slight incline on campus. He was extremely short of breath and collapsed on a nearby sofa to rest. He was rushed to hospital where the diagnostic ECG, cardiac enzymes, and chest X-ray were normal. His BP was 150 by 100 mm of Hg. Pulse was 97 beats per minute. Oxygen saturation was 98%. He was an obese stretcher who had a BMI of 39.7. He had an history of smoking. He had an history of CHD in his family. So the probable diagnosis was stable angina. So going through the lipid profile reports that was there, which covered up the total cholesterol, which showed about 240 milligrams per deciliter, which was higher than the normal desirable value. LDL cholesterol was 178, which was again higher than the normal desirable value. HDL was on the lower limit of the normal, that is 30 milligrams per deciliter. Triglycerides was 160, which was again a little above the normal limit. ApoA1 was 102 milligrams per deciliter, much lower than the normal level. ApoB was 139, which is again more than the normal limit. Lipoprotein A, which is very much elevated, that is 68.3, normal is 930. And ApoB by A, which the ratio was 1.36, again higher. And homocysteine levels were also elevated, along with C-reactive protein also being elevated. So just to brush up with the teaching methods that I covered is a case scenario which was given 2 days prior to the students to come prepared. The assessment was conducted. So the case discussion was done as a role play with lab reports in the lab. Observation guide was there where the students were asked to observe different lab results, share the ideas, and interpret the information that they gathered during the observation, and was also focused on their communication and data gathering. So certain facilitators guide had questions like this. So how are hypertension and dyslipidemia interrelated? Why is the family history of CAD important to diagnose the types of hyperlipoproteinemia? Identify the salient features of effective communication between the doctor and patient. List all the points in this interaction that has helped the patient to understand the information. What are the modificable risk factors by interventions that is likely to lower CAD? Going to the program evaluation, we have collected the structured feedback from the students and to evaluate the improvement in the module at the end of the discussion. A few of them were like how important or how helpful has the EC module been in improving your knowledge about the dyslipidemia. Suggest changes in the program that can help you learn better. The program evaluation also had taken a written feedback from faculty so that regarding their opinion as to whether the outcome was reached and for any suggestions. Also, we conducted a post-assessment using the modified essay question and clinical vignette-based short answer questions so that we could assess the team and individual students. So these were the few essay questions with clinical application. A young man of 45 years who's slightly overweight and has a sedentary job had a health checkup and he was told that his lipid profile is abnormal. So what are the parameters that is included in the lipid profile? If the recommended reference levels of these parameters, explain the biochemical basis of type 2 hyperlipoproteinemia, explain the atheroprotective effect of HDL cholesterol, what are the lifestyle modifications suggested to patient to prevent atherosclerosis, name the vitamins which will lower the homocysteine level. Thank you. Over to Dr. Indira.
Thank you, Hilda. Good evening, everyone. Thank you, Bedi sir, Suchita ma'am, and Pragna ma'am. A big thank you for our mentor. Ma'am, you were a very good facilitator and motivator for all of us throughout this journey. Thank you so much.
Thank you, Dr. Indira.
I'll be discussing regarding the integration, horizontal and vertical. Next slide, please. It is prepared by Dr. Hardik, a significant amount by Dr. Jaya, and myself, Dr. Indira Biswas from JIMS, Kolkata. Next. Next slide, please. For the competencies 4.1 and 4.2, we have prepared certain topics for integration.
Just tap on the screen.
Ma'am?
Tap on the screen and then do next.
Okay, ma'am. Okay, thank you, ma'am. The first topic is describe functions of steroid hormones. Here we can share the objectives with physiology. The second topic is for integration is fatty liver. It's by nesting of objectives from pathology and general medicine. This can be planned as vertical integration session. The biochemical defects of RDS, which is competency 4.1, is by nesting of objectives from pediatrics on clinical features and diagnosis of RDS. The next topic is for integration, atherosclerosis and myocardial infarction. This is by sharing of objectives with anatomy, physiology, and biochemistry, the basic sciences. Nesting can be done with objectives from pathology and general medicine. It can be correlated, but a case scenario can be used as a linker in the basic science subjects. The linker topic is atherosclerosis and myocardial infarction. 1 week in advance, pre-reading material and instructions for the students are provided. Reference to classroom discussion on coronary circulation is provided by anatomy. Physiology provides ECG to the students, and biochemistry, atherosclerosis and cardiac markers, pre-reading materials and instructions are provided to the students. Article link on coronary artery disease should be given to the students. brainstorming sessions by the faculty, development of MCQs in all the three subjects, anatomy, physiology, and biochemistry, discussion with medicine department for case scenarios on myocardial infarction, conduct of mock team-based learning session amongst the faculties, specific learning objectives of module. At the end of the session, the student should be able to explain atherosclerosis and its role in myocardial infarction, identify signs and symptoms of myocardial infarction, choose the relevant biochemical test in diagnosis and monitoring of myocardial infarction across various time frames, describe normal ECG findings and mention examples, common ECG alterations observed in an MI patient, mention the various coronary arteries that are commonly affected by atherosclerosis and usefulness of angiography in identifying the same, explain the usefulness of therapeutic enzymes in myocardial infarction, explain the lifestyle modifications necessary in these patients. The classroom discussion. Students will be divided into teams and faculty assigned to each team to coordinate the team-based learning. Provided with placards displaying the options for MCQ. Conduct of short test. Administration of MCQ to individual students. Assess individual readiness. Administration of same MCQ to individual teams, which were already prepared. Assess team readiness. Discussion. Display of each MCQ one by one by the respective subject faculty and teams asked to raise placards with their answer option. Each answer was discussed by the faculty giving reasons. Case discussion by medical faculty. Case scenario, video of angiography, ECG findings will be dealt by the medical faculty. Questions to the team followed by discussion. At the end of the session, difference in scores in the individual and team performance was assessed. Structured feedback obtained from students. The total time duration is 2 hours, 30 minutes to 3 hours. Thank you. Over to our mentor, Dr. Jyoti Bhatt.
Hello, am I audible?
Yes, ma'am.
Yes, ma'am.
Yeah, I'm speechless. Wonderful presentation by the whole team. It was a great evening for me. And I must salute to you all. I find myself very privileged to mentor such awesome team. Our journey together started on 25th of July, and day after day together we created this knowledge bank. Feeling lucky to be associated with this group and a long way to go, sharing knowledge and hand holding each other. A special word of thanks to all team members for being so cooperative. However, we had some passive members also, but we overcame all the problems, all difficulties, and came out shining. A special reference to Dr. Basu sir and Dr. Jayanta Dey sir, who could not present their SLOs today because of activity issues, but they were all actively involved in the this whole journey. So thank you so much, Dr. Sanjay Bedi sir, for giving us this kind of opportunity, Dr. Sucheta ma'am for mentoring us the overall process, and not the least, all senior faculty members, junior faculty members, everyone who is present in this group. We have got a platform to associate every day with each other, improve, which is a continuous method of doing things. So thank you so much. Thank you so much, the whole team. Thank you so much, the whole CBME group. Thank you. A very good evening to all of you.
Thank you, ma'am.
Over to you, Sucheta ma'am.
Thank you, ma'am.
Thank you, ma'am.
You have really raised the bar higher now. And all
Does
of
anyone-
us are getting cold feet.
Any
Well
questions, anyone? Please raise your hands.
Vedi sir, I would like to especially thank Dr. Hardik. He had been our Sutradhar, backbone, sharing and doing all these presentations, putting together day and night. Thank you, Dr. Hardik. A special thanks.
No, no, ma'am. As a group member, I should do all this work, ma'am. We can do this much great with the help of you.
Yes, Debashish Basu is also there. He has to just unmute himself. I don't see any hands. Yes, there is one hand. Yes. Dr. Sri Devi.
Hello. Good evening, sir.
Good evening.
I just want to find out in the oxidation of fatty acids, does omega oxidation, alpha oxidation, all these are included in 1 hour teaching, or it has to be split into different teaching hours?
Ma'am, we are allotting the 2 hours specifically for the fatty acid oxidation topic.
Okay.
So the just basic things of beta oxidations included in the 1 hour, and the next 1 hour, the regulation part and the other types of oxidation.
Okay, sir. Okay.
So, any more hands? Please let me know. Yes, Dr. Vidya Patil.
Good evening, sir. Congratulations to Group 3 for excellent inputs on lipid metabolism. I had a small query on STL. So, initially, the STL presented was like a case-based learning session. We started with the case discussions and regarding test around the case. How would you actually differentiate between a case-based learning and STL session? Was the case-based learning triggered for STL, or how it was planned?
Dr. Jaya, you can take up.
Yes. Dr. Vidya, you're absolutely right. The case-based learning was acting as a trigger to learn by themselves and discuss. Yes.
Yes, Dr. Jaya. Thank you. Thank you so much.
Yes, Dr. Debashish.
I think finally I have been able to unmute myself. It was a technical issue. I could not get through it. Now I think I am audible. I'm sorry I have gone. I'm sitting here going through the whole session. It was very nice to hear everything. Thank you very much for organizing this whole event. We are so very benefited with it. Thank you so much, sir. If any questions or anything, I would be happy to answer if there is any queries. Hello.
Hello.
Hello, sir. Can you hear me?
Yes, we can hear you. Yes.
Yes, sir. There was a technical issue. I could not unmute myself before. Now I have been using another app. Through that app, I have been able to unmute myself. Sorry, I could not get in my during my scheduled hours. I'm sorry for it. However, I have enjoyed the whole session.
It's okay,
This is
sir. You have put in a
nice.
lot with all of us.
No, it was a team effort, absolutely team effort. Everybody has
Dr.
contributed.
Anita Majur,
Hello?
Yeah, hello. Dr. Bedi, and congratulations, Dr. Jyoti and team. You did an excellent job. I just had one little input. Now, since we were dealing with a lot cases like, angina, atherosclerosis, MI, I was just wondering, could we bring in an ATCOM aspect to this? By introducing the students to kind of how do you communicate to the patient or to the patient's relatives on the lifestyle and dietary modifications that can be, how do we communicate, and so could we put that as a part of ECE, or where can we?
If I can intervene, it has to be a part of the ECE, where one question in the assessment, suppose you convert the ECE into a short answer question, which is which is clinical application type. You can use the ECE, and one question has to be from the ATCOM model, asking them either about the communication or the lifestyle changes, or how will you counsel the family, or how will you counsel the family for diet. So something has to be written. So one question definitely has to be related to the
ATCOM.
attitude, ethics, professionalism, that kind of aspect.
Okay, so it becomes a part of the ECE, ma'am. It's an essential part. We
Yes,
have to fit
it has to be a part of the ECE. That is the reason why I have put it on the group, that I would suggest that the group, just as each of the other two groups also have done, these SLOs, ECE, SDL should be put up on the in the group. Then each one can slowly read through everything, and small, I mean, I'm not saying, I mean, it was just a wonderful effort by everyone, but these small things we can tweak then, as we read through. Because when you're just reading in this webinar, it's difficult for people to catch the small nuances, which we can do, and then it will become like an excellent version. So that's my suggestion, that even this group also should put it up CBME, biochemistry.
Yeah, suggestion well taken, ma'am. Thank you so much.
Yeah.
Thank you, ma'am. Thank you.
So are there any more hands up, Dr. Bedi?
Oh, ma'am.
Okay, so should we say good night and call it a good night? Well done, everyone. Wonderful. And we are all so happy.
Thank you so much.
Thank you,
Thank
ma'am.
you,
Thank you
madam.
so much.
Okay, good night.
Thank you so much, ma'am. Thank you.
Good night. Good night, ma'am.